Hello, everyone. Welcome to Stress and Wellbeing. We'll get to it in just a minute. Just a couple of announcements about this lecture. There won't be any lecture breaks in the middle here. Sorry about that. There's just been some things that have been preventing me from doing those, and there'll be less cuts. So I just wanted to give you a heads up, and let's start the lecture.
Hello, everyone. Today we'll be talking about stress and well-being, and no video today because I need to do this real quick, and I do many more retakes than I think I need to when I have the video on. All right, let's get started. So first we have an overview, as always. Um, we're going to have first cover this topic of occupational health psychology. What is it, and why is it important to know about when talking about stress and well-being? And then we'll just dive right into what is work stress, different models, different ways people think about work stress. We'll talk about family and life. Worker exists inside and outside the workplace, so it makes sense that you start taking a more comprehensive look at the worker. Um, we'll talk about some of the job benefits that support well-being, some information about how job loss and how that can induce stress and hurt well-being, and then we'll end on, of course, a positive note with workplace violence. So let's start off with occupational health psychology. Occupational health psychology is an interdisciplinary branch of psychology. It encompasses basically two fields of psychology: health psychology, which deals with the relationship between physiological characteristics of a person and that relationship with their psychological well-being. So, it's physical health promoting psychological health or vice versa. It also looks at factors that promote physiological and psychological health or well-being in individuals. This is tied. The second field is industrial organizational psychology, and at this point, I really hope you know generally what it is. Psychological principles applied to the workplace. So OHP deals with the physiological and psychological health of a worker, both inside and outside the workplace. So this has to do with not only say, is a worker happy, but is the worker physically safe? A lot of OHP research deals with worker safety and accidents and things like that, worker health, implementation of physical health programs, things like that. So it's kind of a wide spanning field, and it deals with worker health both inside and outside the workplace. IO does deal with it a little bit, but it's an explicit focus of occupational health psychology. It's a relatively new field of psychology, mainly really coming into its own in the late 1980s and early 1990s, and there's opportunities to do that research here at Georgia Tech. My lab focuses on some aspects of psychological well-being of the worker, both inside and outside of the workplace. Dr. Kimberly French's lab is the real sort of occupational health psychology. She was trained by occupational health psychologists down at USF. So if you're interested in that sort of work, um, definitely can help connect you to it.
So I want to ask you just a quick question right now. How are you doing? Like, really, your response when anyone asks you that is probably, well, I'm just doing fine. Everything's just fine and dandy. But and if it is, great. But I mean, in this garbage fire of the last year, I bet you that you've had some sort of experiences that may have stressed you out, and these stressors are going to affect how you think, act, and feel. And within the organizational sciences, the idea is that things within the job that cause you to stress, be more stressed, can affect, say, how you're doing that work or how you're doing more generally, whether that's referring to your well being, your psychological health, or whether it's referring to your productivity. And that's the lens that most organizational scientists approach this stress research. So let's jump into um, this idea of I've been using a lot of terms: stress, strain, um, stressors. Let's jump into it just a little bit more now.
So let's start with the basics by defining what are stressors and what is strain. So stressors are essentially the things that stress you out, the like objects that cause you to experience strain um, are the stressors. So any disruptive event or force that pushes a psychological or physical function beyond its range of stability, producing a strain within that individual. And so, what is strain then? Well, it's the resulting experience, very tautological sort of ties here, is the resulting experience from these stressors, uh, which are called strains, undesirable personal outcomes resulting from the combination of stressful events in various life domains. So the process of stressors leading to strains is what is generally referred to as stress. So you have stressors causing strain. The way that stressors cause strain is referred to as stress. And there's lots of different models that help explain the relationship between these three factors here. There's a We'll cover a couple of them. Mostly the general model of stress, the job demand control model, the which is not really used anymore because there's the job demand resources model, and you'll understand why JDC is not necessarily used as much anymore. And then the conservation of resources theory. So here we have the general model of stress, and we'll dig into these just a little bit more. But that basically it categorizes stressors into four buckets: intrinsic work factors, role variables, interpersonal relationships, and career development. These stressors lead to the perception of organizational stress. However, the degree to which these kind of stressors turn into strain will depend on whether or not you have, say, these appropriate coping strategies, problem-focused coping or emotion-focused coping. But if you say do not cope well, you're likely to experience some job-related strain, emotion-related strain, and physiological related strain. So let's dig into these stressors just a little bit. So first up, we have these intrinsic work factors, and these can be anything from, say, poor working conditions, long hours, excessive travel, and a lack of control. And you'll see this, I think we'll talk about this a little bit more, with Kiyosak's demand control model of stress. Basically, stress is a function of psychological demands of work and the amount of decision latitude, which is control here, provided to the employees. So basically and you'll see this come up a lot, basically what is the demand and what are the resources that you can have to compete with those sort of, or balance out those demands. If you have more demands than resources, again, control is a type of resource, then you're likely to experience strain. And, these things can lead to these deleterious consequences, right? You have heart disease, depression, exhaustion, job dissatisfaction, stomach ailments, absenteeism. Um, so all of these things will likely lead to, if not appropriately addressed, these deleterious strain sort of outcomes. But let's go into the stressors a little bit more. We have these role variables. One of them is role ambiguity. So basically, not knowing what the heck you're supposed to do can be a stressor for a lot of folks. If you have these role conflict situations, so you're getting different uh, orders or assignments from different bosses, or the same bosses changing from day to day. Anytime that you're kind of receiving mixed messages about what encompasses your role, that can be a stressor. Uh, and they're generally not a good thing. These are, again, the strains that you may experience from these stressors: job dissatisfaction, anxiety, turnover intentions, organizational commitment, which is, in the bad direction. You're not going to be more committed when you have ambiguity and conflict. and absenteeism as well. Um, Another set of stressors are interpersonal relationships. So people that you can work with can be a major source of stress. I bet you all sort of notice supervisors, coworkers, customers too. They kind of all fall into this bucket of potentially being a stressor for your job. Career development too. Let's say um, if you don't see yourself being able to move up, that could be definitely a stressor. Or, if you don't feel like your job is necessarily secure, um, that could lead to some problems for your well-being. So we kind of talked about uh, the job demands control model. And this should say uh, demands and control, not control and resources. But anyways, when you have these sort of, let's see if we can go back without messing up. No, I can't. Great. All right. So when you have high demands and a lot of control, those are supposedly active jobs, and that's kind of a good place to be, where your demands can um, exceed the amount or match the amount of control that you have. However, when these two factors are low, those are called passive jobs, where it's not really demanding, but it's not really, you don't need a lot of resources to match those demands. Those are passive jobs, and these are usually kind of okay things. You kind of want to be in this bucket here. Um, the problem comes when there's an imbalance. So if the job demands are high and you don't have a lot of control, those are high strain jobs where you're not really um, performing well. You're under a lot of strain and can have some deleterious consequences on your physiological and psychological health. Um, and low strain jobs are okay. There's a relationship between stress and job performance that basically says you need a certain amount of stress in order to perform well. So if your job is boring, then it's not really going to help your performance. But at one point, there's a certain balance, which is good. So it's the apex of this curvilinear relationship. But once your job becomes too stressful, your performance starts to decrease and fall down. And so low strain jobs may not be producing a lot of strain, but doesn't mean that you're going to be happy about it. You can be doing something that's um, extremely boring. And yeah. So extension of the job demands control um, model is the job demands resources model. And basically it just opens the gamut to a whole bunch of different resources um, that you can have. So it's not just control. And so it's the same sort of like idea of the balance between demands and resources, but in this model, the resources include things like support, autonomy, feedback, harmony, coaching, etc. So it's really just an expansion of this general idea of a balance between the resources that you have and as related to the demands of your job. The last model that we're going to cover is the conservation of resources model. And essentially, this model says that, well, we're obviously still dealing with resources, but individuals want to keep like these psychological and physical resources. Basically, you don't want to exude resources, whether that be, your mental energy or anything else, um, if you don't get something in return. And once you start losing these resources, it plays a critical role in the stress process. Limiting uh, resource loss is key to the prevention of stress and post-stress intervention. So here really becomes the idea that you want to make sure that you're not exuding too many resources without some sort of um, ability to gain those resources back. Um, that's what conservation of resources theory is about. People want to keep their resources, and when they spend them, they want to spend them in a way that allows them to get resources back. So I got a question for you. What no. What stress is best? Now, so far we've generally been talking about how stress is generally well a bad thing, but that's not always the case in some theories. There's this idea of a challenge and hindrance model of stress. So when stressors are, say, challenge related, these things are resulting from like additional time pressure, high level or some great degree of responsibility or job overload. When you're able to, these stressors are said to increase these, you know, positive outcomes, job satisfaction, and well, potentially job search. Um, so the idea is that these things, these stressors actually lead to some positive outcomes, but some negative outcomes as well. But the idea is that, you know, it's not this consistently negative relationship. However, you do have these hindrance stressors, and these are things that, let's say, prevent you from doing the things that you want to do. Red tape, politics, job insecurity, things like that. And these will lead to, say, decreases in job satisfaction, potentially increases in jobs search, and more voluntary turnover. Um, and so the idea, I know I went off on a tangent a little bit earlier, that not all stress is bad with that curvilinear relationship between stress and job performance, but this is another way that you can frame it. Some of the stressors themselves may not necessarily lead to uh, strain, the negative strain that we've been talking about. Speaking of strain, let's ask the question, what kind of deleterious effects can stressors have on you? Well, there's three types of strain that we're going that I think you should know. Job related strain. So you have lower job satisfaction, lack of motivation, ineffective performance, increased absences. You have emotional strain, so it's more of your psychological well-being. You have less patience, increased irritability. There's a more recent construct called burnout, and you have it composes of three constructs: emotional exhaustion, which is exactly what it sounds like; depersonalization, where you detach yourself from basically the work that you do, the people that you work with, etc., and reduced personal accomplishments. This doesn't necessarily mean that you are doing less. It just means that you tend to downgrade the stuff that you do accomplish. And so when you're experiencing burnout, which is a lot of cases in these high stress professions, it could be well bad, and also physiological. So life and work stress predicts the frequency of serious illnesses. You know, having more stress can affect your autoimmune system, and you can definitely get or likely to get more sick when you do experience more stress. I forgot what it was. There's this old study, I think by Cohen, like in the 1950s, where he exposed folks to some, virus. It wasn't like a, COVID virus, but it was a virus nonetheless. And in one condition, he stressed the crap out of folks, and the other one, he didn't. And he found that people in the more stressed out condition were more likely to um, get sick and also had worse symptoms than the one in the folks in the control condition. So it was like a direct tie between um, your stress and your autoimmune system, trying to combat a virus. So what? Who cares? I've had this before. Hard work never killed anyone who supervises it, so that's the supervisor not dying. Well, yeah, generally these things matter if your employees are stressed out, not only for say well-being, like being a good person reasons, but also because there's high costs. There's people calling in sick and leaving, and all of this leads to about $300 billion in the U.S. of like how much it costs organizations each year. It accounts for 19% of absenteeism and 40% of all turnovers related to people being stressed out. There's also, of course, the people cost. We talked about, people not having um, high well-being, but folks are more likely to commit suicide. And there's an example of death from overwork with karaoke. And if you want to look that up on the internet, you can. But if you're not in a very positive mood, you probably don't want to watch it. It's like listening to Elliott Smith when you're already pretty sad. It's gonna kind of it won't make things better. Let's just say that. So yeah, it's great that we know that stress and strain are related to one another, but what do we do about it? We cope. And there's a lot of poor ways to cope, as you can see here. This has been my preferred way during the pandemic. Um, you can also, start getting drunk and yelling at people and taking your personal rage out on copy and printing machines, but there's probably better ways to manage or reduce your stress. You can take a focused approach to coping with your these stressors. So behaviors or actions targeted towards solving or handling the stress inducing problem itself. So it's like making sure that your time management, mentoring, role negotiation, reducing your task roles because you're just overburdened, getting some help from a mentor, or making sure that you're managing your time appropriately. You can also do emotion focused coping, which is basically cognitive strategies that minimize the emotional effects of stress inducing events, finding some sort of silver lining in it, downplaying the negative effects. So what, this happened to me, it's not going to affect me really on the day-to-day life, though it may be frustrated. Some ways that you can do more emotion focused coping is through exercise, meditation, finding some social support, or some clinical counseling. And for everyone here, it's like, all right, so those are nice, but what works best? Well, it kind of depends on the coping method that you want to use, the stressor itself, and one's view of themselves. Um, so it all depends on a lot of things. You got to find out kind of what works best for you. Some people can meditate, some people can't. When I was doing this research with emergency medical folks at Emory, um, some folks said that mindfulness exercise worked really well for them, say after a patient dies in the hospital, while others say it just made things worse. It just made them more open to ruminating on um, the deaths that they experience. So, it's just really up to what works best for you, which is somewhat troublesome when you are trying to be an organization instilling some policies, and you find that different folks react differently to to these different coping methods. A little bit more on coping. Organizations are starting to promote more coping training. You have this which tries to assess sometimes as emotional competence, which is the ability to understand, express, or manage feelings. If you have more emotional competence, you are more likely to have greater psychological well-being and better social relationships. Um, I think out of everything, and this is very hard to do now, the thing that protects your well-being the most is having the appropriate social support. So someone to vent to, someone to talk to, someone to kind of get things off your chest, because if you keep it all in, then you're more likely to spill that over into other domains. So that happens a lot of times when you have something that stresses you out at work and you carry that stress, you ruminate on the way home from the commute, and then you're going to have more conflict when you get home. So having this a good social support network, whether it's through coworkers, supervisors, or families, is super important. Switching gears in a less dramatic way, um, we're going to now talk, or I think we talked about the determinants of strain, but we really haven't talked about well-being. Everything has been like bad, right? Like everything that stresses you out and it leads to these negative consequences, except with respect to the challenge stressors. But we haven't really talked about well-being. Well, first, I think it's important to define what well-being is. So we've talked about what is well-being a little bit in previous um, lectures, especially I think it was in one of the discussion questions lectures that I do. But um, there's this idea that well-being is just happiness, and it's a lot more than that. The way that we separate, say, your psychological well-being is into two different sort of categories. I don't know which way my hat should do to look like. Two different categories. So you have this psychological well-being, the construct is called psychological well-being. It's eudaimonic well-being. So let me reset. There's two fundamental sort of foundations to the way that you conceptualize well-being. One is a hedonic approach, which is how you are currently feeling, your positive affect, your life or life satisfaction, your negative affect. And then the other side, you have your eudaimonic well-being, oftentimes called psychological well-being, which is doesn't really tell you what it's about. Eudaimonic well-being is a lot better, but that is more of a Aristotelian sense of what does a optimal person look like, you know given the characteristics of what a human is, what is the optimal functioning of a human? So um, it tells you what you should do to feel happy. So feelings of competence, having good social relationships, autonomy, um, all these sorts of value systems that we believe that we ascribed onto what a perfectly functioning human being is supposed to be. That's a eudaimonic or psychological well-being. It tells you what the good is. On the converse, you have this hedonic well-being, or sometimes called subjective well-being, and that doesn't care what makes you happy. It just ascribes, it just asks you how satisfied you are with your life right now. What sort of positive emotions are you feeling? What sort of negative emotions are you feeling? And so this doesn't even include the idea of well-being encompassing more physical health characteristics. So the degree to which you're exercising, your physical health, with respect to whether or not you have any um, diseases or bodily functions. And so well-being can be a lot of things, but the main breakdown for like what psychological well-being is in the head is this eudaimonic versus hedonic approach. And that is mostly what we focus on within the organizational psychological literature, besides of occupational health psychologists. So what are the things that promote well-being when thought about in this way? So when we're talking about the determinants of well-being, whether it's psychological or subjective well-being, hedonic, eudaimonic well-being, WAR has this nice little, um, I guess, framework of different kind of promoters of well-being. The framework provides a way to further investigate how individuals interact with the workplace. The more employees experience these determinants on the job, the less likely they're experience negative well-being or ill-being. And so, for some determinants, may point to um, for some determinants, there may be a point in which more is not necessarily better. And so he came up with this nice little framework that links to, say, other stuff that we've talked about in class with motivational theories. So more resources, like opportunity to engage in personal control, opportunity for skill use, having more variety in what you're doing can lead to more well-being, availability of money, would be super great. So again, this is kind of it's all related to one another, which is interesting because the fields generally separate, well-being from strain when you're investigating it. So you're not looking at both the positive and negative side simultaneously. And so what we really need is kind of this general framework of more or less this general framework of stress that incorporates both the negative and the positive simultaneously. And we have that. It's just that people don't research it together. They usually focus on the negative or the positive. And on that note, we'll switch gears again one more time with just a GIF of that amazing scene from Speed Racer. So job-related features aren't the only thing that causes stress. We can also have stress from the family environment. So we're going to talk about the work-family interface for just a minute here. So the work-family interface is basically separated into these two constructs. So you have work-family conflict, which is basically exists when work and family domains do not fit well, results in one role having a negative effect on the other. So if you have a bad day at work, you spill over to home. If you have a bad family life, you may spill over to work. So you can dissect this a little bit more, and because there's work to family conflict as well as family to work conflict, but it's kind of hard to tease that apart. It's kind of like a chicken or the egg sort of situation. So unless you're actually measuring experiences through which people go through, then it's really hard to say it's work to family or family to work. But that's a story for another day. When you have more conflict, you're likely to have lower job satisfaction, life satisfaction, poorer health, engaging in poor poor health behaviors, and less career success overall. On the other hand, there is work-family enrichment, um, which sorry, my wife just sent me a text talking about there's lots of mosquitoes in the garage. Whatever. So there's work-family enrichment, which takes a positive spin on it. So it occurs when attitudes and behaviors have positive carryover from one domain to the other. Again, this is bidirectional, where you can have a good day at work, so you're better at engaging in family activities, as well as if you have like a good night before, you may have a better family or work experience the next day. It's simple, right? Yeah, bad things lead to bad things, good things lead to good things. Again, higher job satisfaction, higher family satisfaction, better health behaviors, and less depression. And so there's this whole model of work-family interface. There's actually two. I think we're going to be talking about the spillover crossover model here in a second. But essentially, the predictors of work-family conflict and work-family enrichment are personal and family variables, as well as work variables, as well as personal coping strategies and organizational coping resources that will lead to work-family conflict or work-family enrichment. And if you're experiencing either of these, they'll lead to those outcomes that we talked about, either sort of work-related job satisfaction, or well-being related, like life satisfaction and depression or less depression. This model is a little bit more nuanced than the previous one. So this talks about, and it kind of, I guess it only looks at heterosexual relationships. I didn't realize that until right this moment. But it should be like spouse one or spouse two, because it doesn't matter gender here. Even, just wanted to point out gender doesn't matter here, even though it has these labels. Anywho's, so here it's a kind of let's take it one at a time. You have these stress factors, which lead to work-family conflict, of course. And you have these motivational factors like job resources and engagement, which leads to work-family enrichment. And the degree to which these things sort of spill over into different environments affects these interactions with, say, family members, right? So social support, social undermine, and which leads to well-being. And this general model, you can see like these two things are relatively independent of one another, the work and the spillover factors. It is here when, the two partners in a relationship start affecting one another. So the spillover occurs within a person over time, and the crossover occurs between you and, say, your partner. And it's a really sort of nice way to encapsulate the individual and dyadic effects of work family, say, conflict or enrichment. So the research on the work family interface generally says um, work family conflict is not significantly related to career satisfaction for men, but it is for women. For older men, work family conflict becomes more important, uh, meaning that they're less tolerant of it. They don't want to have work family conflict anymore, which you know is interesting, but not really helpful in prescribing policies. The culture of the workplace, I'm sorry, not the workplace, national culture um, affects the relationships that work family conflict has with other variables. So there's definitely cultural differences in work family conflict. The U.S. has overall a lower family to work conflict than other countries, and Asian collectivist countries have more family to work conflict than those from individualistic countries. And lastly, I don't think this is lastly, I think there's something else, but there is adaptability. So this all falls under this idea of life management theory, where people who have a more organized life by setting goals and refining their strategy, and are more flexible when some things come and to mess up those plans in which they have um, developed, perceive less job and work stress, and have lower levels of work to family conflict. Generally, if you are more flexible of a person, but also pretty conscientious, you're less likely to have these spillover effects. So, how do we support workers? What can we do for workers? Well, there are these particular family supportive supervisor behaviors one can engage in. Essentially, instead of just getting the supportive behaviors from your coworkers. You can also, and friends, it's also important to get them from your supervisors. So this was developed, I guess, more uh, than 10 years ago now. The new measure demonstrated incremental validity over more general social support measures in predicting various outcomes related to work, family, job satisfaction, and job turnover. So your supervisor plays an important role here in helping manage work family conflict, as does the organizational culture. So if you have a more supportive culture, there's less work family conflict and less stress. Even if you have perceptions of support, it doesn't necessarily mean that it's more supportive. As long as you perceive it as such, there's less work family conflict. Um, Allowing individuals to be more flexible. So again, this is providing more resources, can help as well. Increases employee engagement, job satisfaction, intentions to stay. Individuals who have more flexibility have less spillover and better mental health. And here is just a list, and I should have edited these slides a bit, of some of the general benefits that can help facilitate um, work-family conflict, as well as promote psychological well-being. So you have these traditional benefits, child care benefits, elder care benefits, flexible work arrangements, and leave and time off, and as well as, and we've linked these a lot to less stress, less work-family conflict, etc. But less um, research has been done on more non-traditional benefits because they're less often to happen. So on-site physicians, dry cleaning, postal service, take-home meals, preferred banking. So all of these kind of non-traditional resources have not necessarily been looked at, and research still needs to be done to see the degree to which they support the decrease in stress and decrease in work-family conflict. Unfortunately, we find that organizations differ substantially on their ability to even provide those more traditional resources. And so a survey in, I guess, 20 over the course of 10 years, 79% of middle to higher income employees report being allowed some paid time for personal illnesses, and only 39% of employees report of low income employees report the same. 54% of middle and high income employees were allowed to take a few days off without losing pay for a sick child, and this only occurred for 24% of low income um, individuals. And so there's definitely a discrepancy in, say, how much you get paid and the resources that the organization provides, which is not super great. So, the lower tier, just because you're making less money doesn't mean that you're not entitled to some of these resources and abilities to be kind of more flexible. In fact, you probably need more flexibility if you're not getting paid much. Let's talk for a second of family-friendly benefits. In fact, we'll talk a little bit about each of these four categories: family leave policies, child care benefits, elder care assistance, and dual earning couples. So first up, we have the Family Medical Leave Act, which sucks. Employees can take a job per protected unpaid leave for up to 12 weeks, and who wants to get paid or can live unpaid for 12 weeks if you do not have another spouse earning job? The problem is that, say, 40% of those who take this leave must cut their leave short because they can't afford to not work. And also 25% of people actually borrow money during this time. And I mean, the reason why many people take the family medical leave is when they have, say, a child, and if they don't have necessarily good insurance, and even if you have good insurance, that's going to cost money that you're going to have to pay out anyways. So not only are you not getting paid, but you're also incurring the cost from the crappy medical health insurance system that we have now. In contrast, parental leave in Europe basically allows you to take paid leave when you have, say, a child or any other sort of family related situation that you have. Belgium even allows for a career break. So people, they provide an allowance payable by unemployment insurance, provided that the employer hires an unemployed person to replace the worker who is on leave during that time. So essentially, you can leave for a little bit and then come back in, which is super great. But not here in the US. We are all cogs in the organizational machine. Um, I mean, you hear me talk about this and you start to wonder why I went into a career in IO psychology. Well, that's to change it, but that's again a story for another day. Childcare benefits aren't necessarily super great either here. Many companies have begun to give serious attention to childcare benefits and other childcare programs. Difficulties are linked to things like absenteeism, turnover, productivity, leaving work early. It's also linked to indirectly to employees' productivity. On-site childcare is a popular feature. It can really help recruitment and retention tools, seen as a positive for the user, and may serve operational costs. Um, Purdue had a nice thing where they had a childcare facility, multiple childcare facilities on campus, and they were really great. They also served as research hubs for understanding childhood development. So if you sent your cool kid there, they would also go through these experimental protocols. I mean, not stressful stuff, just looking at development over time. And so, from a research perspective, that was pretty awesome as well. All right, I think, close to the end of, well, at least this section. We have just a couple more to go. Um, Family friendly benefits with dual earning couples. So, couples in which it's really difficult for couples when both individuals are working to maintain a solid family life. Uh, we're seeing an increase in these dual earning couples. By 2002, 78% of married couples both worked. Only 17% conformed to a more traditional model. And the biggest advantage of the dual earning couple is, well, you got more money, which is can be super nice. But there is this third job, taking care of home and family. And you see that even in dual earning couples, women still do more of the housework. But men do 7+ hours of housework per week, generally, which has doubled since 1968. Still, there's even more recent stuff that's come out with COVID where you have, say, dual earning couples and the expectation for women to engage in more of the housework, and the degree to which they engage in the housework is still more than men. So that is, this is in dual earning couples. It's not, folks following this more traditional model. So that is not great. And hopefully you can find someone who does more than 7 hours a week of household work, whether you're a man or a woman, um, going whenever you find your spouse. A little more information on dual earning couples. Research has found a longitudinal crossover effects of work family conflict and work family enrichment. For example, husband's work family enrichment was negatively related to a wife, their wife's depression 1 year later. So that's the kind of this positive crossover effect, right? So if the husband has more work family enrichment, it it helped the wives in the study be less depressed even 1 year later. The parallel effect was found from wife's work family enrichment to husband's depression as well. Um, so work family, excuse me, but it can have these negative effects as well. So increased work interfering with family, that's what that stands for there. For one partner can increase the family interfering with work for another partner. So if you have like a bad day, you carry it home, and then you have a bad day at home, that can actually spill over into your spouse, who will then have a bad day at home and take that into them uh, at work. So that's what that um, suggest. And there's similar crossover effects to their children and affecting their well-being. So that's not basically, if you have a happy household and you're more likely to have a happy work, and if you have a happy work, you're more likely to have a happy household. All of these things influence each other, and so kind of what I want you to get from this right here is that the study of organizational psychology, or IO psychology in general, is not beholden or not constrained to just looking at the worker within a particular domain. You know, the worker is a person that exists both inside and outside of the workplace, and factors and experiences happening to the worker um, outside of the workplace influences how they behave, think, and feel within the workplace. So it's important to take more of a person-centric approach to organizational science, but um, and even though we've been saying it for past couple decades, it's still not taken on. Everything is still more organizational centric. So let's talk about job loss. To answer this question, we must first think about why jobs are important to us. Of course, it's because we get paid, right? I like money. You like money. We all need money to live. And so that's one reason why it's important to us. It reduces the ambiguity of your day-to-day lives. It provides some sort of structure, time to day. More ambiguity that you have, the less likely that you're going to be happy. It provides one to use the skills they have and develop new ones. You know, if you take more of a learning oriented approach to your work, you're going to have a good time. But if you take more of a, I just need to clock in and clock out, then you're going to have a bad time. And you can demonstrate your skills like incorporating GIFs into PowerPoint presentations. It provides a good social interaction with people outside of the family. You don't necessarily need, depending on your family, you may have a good social support there, but if you don't, there's maybe some things you can't talk about family stuff with, and you can develop these personal relationships at work, which can, facilitate your well-being, as we talked about earlier. It gives you sort of this purpose in life, depending on the job and the career stage that you're in. It doesn't necessarily have to. I think we talked about a little bit about this with organizational calling earlier. And it gives you identity of, say, for me, like organizational psychologist and prestige, like earning lifelong achievement awards. And so if you lose a job, this stuff, whether the degree to which affects you, some of them have to. I mean, financial means for most of us will affect us. It can have some really bad psychological consequences. And here are just some facts about it. The U.S. organizations have been reducing the size of the workforce since the 1980s. Recently, this has increased dramatically. Your parents probably know more about not pandemic caused layoffs. Um, it can be relatively dramatic, and you can kind of see a zeitgeist of folks laying folks off in the mid 1980s. And they're just generally reducing their workforce because they realize that they need less people to do the jobs that they have. U.S. workers are even more concerned about losing their jobs than the data suggests that they should be. Basically, your job is likely going to be fine, but people just have more anxiety about it. So, especially in this environment where we have uh, the AI is going to take over my jobs, people are very distressed about that. The thing with AI, just a real quick tangent, is that it's not necessarily going to take over your job. It's going to take over particular tasks that will still lead to some degree of job loss. But that just means that for many people, your position is going to be redefined and maybe focused on many of the tasks in which the AI cannot perform. Um, so the research suggests that employees' ability to distance themselves from the job loss was negatively related to distress about job loss and positively related to reemployment. So if you can separate yourself from it, you're more likely to be employed and you're less likely to feel bad about it. Layoff survivors. So these are people who say there's a string of layoffs and you were lucky enough to keep your job. That's who layoff survivors are. They tended to be less productive, less trusting, and more angry and anxious, lower morale, and lower job satisfaction. So that anxiety probably increased about them losing their job. They have less social support since their friends got fired, and they are more in like this I need to preserve my job attitude rather than I feel comfortable and safe at my job. So job loss not only affects the people who got fired, but also the people who did not get fired or laid off. So job loss creates a myriad of losses. So all of those things that you had that increased well-being, well, they're now gone. So you no longer have these factors that influence your well-being. Additionally, when companies are laying off people, they're less likely to provide resources that can promote these predictors of well-being.
Now let's switch topics just for a second and end our conversation on workplace violence. Homicide is one of the leading causes of death among American employees. During this 4 year period, there were an average 551 homicides at work per year in the U.S. So it's flexible work schedules. I'm guessing that number is going to decrease in 2020, just because people are not at work. Greater than 2 million Americans self-reported that during the preceding 12 months they had been a victim of some sort of physical attack. 6 million reported that they have been threatened during the past year, and 16 million reported that they have been harassed in some way. It's an extremely serious issue, given that these all take place in a work environment. And so, why are we talking about this now? Well, there's a strong link between job stress and workplace violence. So some of the risk factors that related to an assaulter is, so these are the things that may create an assaulter, is that mishandled termination or disciplinary actions, as someone get fired coming back to work, bringing weapons onto the work site, drug or alcohol abuse on the job, holding a grudge over a real or imagined grievance, personal emotional disturbance, hypersensitivity to criticism, recent acquisition with or fascination with weapons, obsession with supervisor, coworker, or employee grievance, and preoccupation with violent themes. All of these are identifiers of some sort of potential perpetrator. And there's also risk factors of being assaulted as well at work. So having contact with the public increases the likelihood. Being involved in exchange of money, delivering passengers, goods, or services, having a mobile workspace like a taxi or car, working with unstable persons, and working alone or in small numbers. So anything dealing with people increases the likelihood of you experiencing being assaulted. And so here is another way to characterize the assaulter. So assaulters are generally white male employees between the ages of 30 and 60. A social isolate with no one knows very well, experienced at least one triggering event within 1 year of the violent incident, often vocally aggressive and acts out with violent behavior, often exhibits bizarre and unusual behaviors observed by coworkers, and will exhibit one, often two or more of these behavior warning signs. So just generally being violent, looking at that they may have some sort of psychological disorder, being depressed, being chemically dependent, whether that's alcohol or some other drug, being observed with obsession with another individual, some sort of occupation, whether romantic or otherwise, chronically frustrated, and a preoccupation with weapons. So be on the lookout for crazy people. But generally, we hope that the job will be able to identify these things before it comes to a head. So let's finish off on these workplace violence models. And so we have this initial model. I think this is only the model we go through, actually, with O'Leary, Kelly, Griffin, and Glue, which is interesting. So you have these individual characteristics which interplay with these organizational environment characteristics. And what we see here is that this interplay between these two characteristics leads to some aggression. Now, if once a person acts out, it may lead to actual violence, depending on the response to the organizational motivated aggression. If there is some sort of positive response, this is less likely to lead to more violence, and then the organization needs to respond in kind. So response to organization motivated violence and proactive modifications of these antecedent factors here, which is why this box leads back to individual characteristics and organizational environment characteristics. Just to be clear, organization motivated aggression is attempts by someone inside or outside the organization to cause injury or be destructive as a result of some organizational factor. So this is the actual behaviors. Now, the organization motivated violence are the negative effects on people or property that result from this particular aggression. And it's important that you realize that both the individual characteristics and the organizational characteristics play a role here, and the organization's response can change these individual and organizational characteristics as well. Oh, there is another model, but we don't have a picture of it. So the Marantinko and Zellers provides a second model for organizational aggression, which talks about how high levels of frustrating events lead to greater incidences of aggression at work. Employees who tend to exhibit violent and aggressive behavior also were rewarded in the past for these particular sorts of behaviors. Don't promote someone if they're being overly aggressive. They often have these poor role models at work too. So it's just kind of perpetrating this mentality that these behaviors are acceptable. A high external locus of control employees. So, people who don't take responsibility for their actions believe that, they have no way to change their behaviors, are more likely to respond to negative events in an aggressive or violent way. They're less likely to take an introspective approach and believe that some of the negative events that occur at work could be a reason, like they're responsible for it. They're more likely to blame environmental characteristics. And males are considerably more likely than females to be aggressive and violent in the workplace and in general, but that's neither here or there. And so here we are for a direction of future of work. So strategies to reduce bullying and workplace violence should include surveillance, training, coaching, and the development of effective HR policies. This is relatively difficult to do because of that locus control factor, right? So if you need people to recognize that they have an external locus of control and that they are in control of their behaviors, that can help them become a better person and not respond so negatively to or aggressively to negative events that happen in the workplace. Strategies should also be directed towards subtle, covert, and verbal aggression. So it's kind of the types of aggression that occur are not always the most sort of prominent things. You need to be more cognizant of these subtle or covert or the more verbal aggression. All of the types of aggression probably need to be called out, or definitely do need to be called out and addressed in some way. And that wraps up this lecture. So here are just some of the reminders. Your discussion questions for 11, 12, and 13 are due on 4/12. We have a synchronous class on 4/14. We have a debate class coming up on 4/5. And the quizzes for chapters 11, 12, and 13 are due on 4/19. I didn't put a lecture break into this lecture because I have some things going on and didn't have time to do it. I'll actually maybe not be there if you're watching this before next week. Next week will not be there for the debate. That all depends on how some personal things goes. But I'll do my best to be there and to support you in however I can. The schedule may change a little bit. I just want to forewarn you of that. That's how these personal circumstances are the degree to which these personal circumstances are affecting my daily life. So, just wanted to give you a heads up. and we'll talk soon.